Okay, so you just found out you're pregnant. Congratulations. Or maybe you're scared. That's okay. A lot of people are. Take some deep breaths. Take a nice diaphragmatic breath when you find out you're pregnant. Into your belly, exhale and let it go. This will be the breath that you use to deliver the baby. Okay, but you're going to want to train it your entire pregnancy. Right when you find out you're pregnant, a few things you want to do. You want to think about, okay, where do I want to have this baby? Do I want to have this baby in a hospital? Do I want to have it at a birth center? Do I want to have the baby at my house? Now, maybe you're a little freaked out, but you need to deep dive the world of home birth, of midwifery, and of a hospital based birth. Just figure out what is most optimal for you. Maybe you know you hate hospitals and it's not the vibe. Maybe you want to have your baby at home. Maybe you've dreamed of having a water birth. Figure out all the options possible for you and find out intuitively what feels good for you, what feels safe for you, what feels safe for your partner, and how can you decide where you want to have this baby. Then go search for a provider, if that's the move for you, of what provider that can support the style of birth that you want to have. Now you get to decide, okay, do I want to have a C-section birth or do I want to have a vaginal birth? Now, sometimes people end up having a C-section birth and they can't control that they had a C-section birth because it becomes an emergent situation. One way we can help optimize the body for a vaginal birth and a C-section birth is by prepping your body for the delivery itself. So you might think, okay, yes, I just need an exercise program. Newsflash, the exercise program isn't necessarily going to be the main thing that you're going to want to invest in your pregnancy. Yes, movement is super essential. And yes, you can pretty much find any free workout you want for pregnancy on YouTube. In fact, we even have some pregnancy safe workouts on our channel. So you can check that out. However, what I think is most important is finding out how and what changes are happening in your body. We can link you to our birth prep workshop from this video, and you can go watch the entire video and find out the changes that are happening in your body during your pregnancy. Then you want to find out, how can I support those changes so I can prevent injury? How can I prevent injury? How can I prevent getting a diastasis? If you don't know what a diastasis is, that's where your abs start to separate during your pregnancy and people start to feel like they have a hole in their stomach. We want to prevent that. So what can you do to prevent a diastasis? Learn how to contract and utilize your transverse abdominis muscle and your different core muscles and modify your body mechanics in using different breath patterns. You can find all that on our pregnancy birth prep workshop. Now you want to figure out, how am I going to get this baby out of my body? Okay, maybe you want to have a vaginal birth, even if you want to have a C-section birth. You want to learn how to breathe your baby out and get the baby out of your body with as little trauma as possible. There is a lot of times people deliver vaginally and they'll have perineal tearing, meaning they'll have a tear outside their vagina or inside their vagina where the baby comes out, and the tear, because the tissue's not used to expanding that far, then they'll get stitched to stitch the perineum up in order to help repair it so mom can heal, and then you'll go on your merry way. A lot of times it takes multiple hours of pushing and really holding your breath for a long, long time in order to get this baby out. You might feel like you're going to pass out, or like you're pushing more than just the baby out of your body, which you absolutely are. Therefore, you got to figure out how to breathe baby out, because guess what? It's actually the uterus that pushes the baby out, not you using your muscles volitionally. Now, yes, sometimes you have to resort to that if you don't know how to relax your pelvic floor and let the uterus do its job. But that's why, since you just found out you're pregnant, you can utilize using your breath and learning how to breathe baby out of your body. You can go buy my book on Amazon, The Secret to a Tear-Free Birth and Fast Postpartum Recovery. And that teaches you exactly how to get baby out of your body fast. And we also have an online program. You can go ahead and buy the online program here. We'll link it in the bio, and you can find out all the ways to have and optimize your body for a less complicated birth. If you do all of these tools and you still end up with a C-section, guess what? Your body is more open. So you recover from that C-section much easier, and your core recovery will be extremely better than if you hadn't done this at all. So I think the best thing you can do when you find out you're pregnant is, yes, figure out where you want to deliver, and B, find a pelvic expert physical therapist, someone who can guide your body and support these changes. If that's not accessible, and even if it is, no matter what, use our online birth prep program to support your body changes. If that is too big of a commitment, then get our book on Amazon. It's nice and cheap. It's cheaper than your coffee for the week. So go buy the book and figure out everything you need to do. There's exercises in that book. There's stretches in that book. There's breathing meditations in that book. And it will guide you on exactly what you need to do in order to prep your body for birth and have this birth cause you less damage, whether that be it from a C-section and or be from a tear or using forceps or using a vacuum in order to get the baby out of your body. We want the baby to come out of your body as easy as possible with as little injury to you as possible so you can have a quick recovery. It is these birth injuries that tend to plague us with more issues down the line in 10, 20, 30 years from now. And so in order to help set you up for your future self, we want to prepare you for birth. Now, the more you can learn how to use your muscles in the pregnancy, the better you are going to show up to your delivery. I'm Dr. Allison Felt, owner of Body Motion Physical Therapy, owner of the Body Motion Birth Preparation Protocols, and I have created this online birth prep program just for you. So go check it out, go download it, get yourself acquainted to everything that's happening in your body, learn how to support these changes during your pregnancy, and prepare yourself for the birth that you want to have.